Okay, ActionSA has launched its campaign for the 2024 general elections, having this past weekend launched its election manifesto. The party has also fielded Kgoshi Letsiri Phaahla as its premier candidate for Limpopo. He joins us now to take a look at what is working and what needs improvement in the province and how ActionSA plans to plug the gap. Thank you very much, sir, for your time this afternoon. And so, as we mentioned, we went around the office as a team asking people from Limpopo specifically what they find works and what doesn't work so well about the province. And so they mentioned the issue of roads, the R101, the Old Pretoria Road, as well as Kranskop Road, the points of entry and exit into the province not being that well, while they have acknowledged that the N1 really good. And so what is your understanding of the road situation in the province?
Thank you, and good afternoon to your audience. I think it's a well-known fact that the road infrastructure in Limpopo is very much in tatters, and the road that you just mentioned, it has been neglected for some time, and it's a menace to drivers, especially those who will be driving on that road during the night. It's a terrible situation that one finds himself in driving on that road. And the obvious thing is that there is an agency that needs to take care of these roads, and none in that agency is interested in looking at the old roads, but most of them only concentrating on the N1 road. So it is applied for drivers to say, can someone assist us in trying to fix the status of these roads, and who will be coming in as ActionSA to ensure that we look at all aspects of this road infrastructure.
Have you identified that someone that may come in and help?
Certain roads are the responsibility and competence of municipalities, and they are looking at other things than fixing the roads, and who will be ensuring that each and every agency that has got a particular responsibility to look at something else, he has to do it, irrespective of the position someone is holding, but he will be or she will be held accountable for anything that he or she has not done in terms of his or her mandate.
Then you've got the issue of the rural and the urban vote in Limpopo. People from Sekhukhune district have mentioned the issue of access. For instance, certain facilities being too far. Another issue that has been raised in Sekhukhune, for instance, is children who are still in 2023 having to walk for kilometers to access facilities of learning. When it rains and the river overflows, those children are not able to go to school. In Sekhukhune district, you've got schools that belong to ZZ2, and you've also got transport schemes that are provided by ZZ2, an example of how the private sector is doing good work in that space. But what is your understanding in terms of access for education and for also for people to get to spaces that they need to go to, never mind hospitals?
Yeah, this has been a long-standing issue in the area of Sekhukhune. It is not a good thing to see children walking for more than 5 kilometers to attend school. And government in Limpopo, as well as municipalities, as well as the mining companies, have been alerted of this challenge, but no one is coming to the party in terms of resolving this matter. It's one of the areas that we exposed as ActionSA to say, if we come into power, these are the first things that are at the doorstep of these rural people that we must fix and ensure that there is quality education afforded to each and every rural child, and as well as having the right infrastructure to ensure that whatever vehicles that will be transporting all these children will have to travel through roads that are well maintained.
How, sir?
There are rural roads that belongs to municipalities in terms of demarcation, and it's just a question of someone having a goodwill to ensure that something is done. And focus is diverted to other issues that are of less importance to these rural people that we're talking about. And it's only someone who can force these people to do as they do in the form of good governance, in the form of good leadership that will be in place, in the form of a good party that listen and attend to issues that are of bread and butter status to all these rural communities.
Then there's the issue of electricity, which once again boils down to the urban versus rural versus township access. And so you've got people in rural areas. A colleague speaking about issues in Tzaneen, for instance, where for weeks people did not have electricity. More so in rural areas where they don't even have access to basics, right? So in terms of service delivery, whether you're speaking about water or electricity for that matter. So what is your understanding of the issue of access when it comes to electricity to rural areas, access to water in rural areas in 2023? What is inhibiting that in some spaces in Limpopo?
Luckily, I happen to come from Sekhukhune and also had the privilege of looking into their IDP document from, say, 2017 up to date. All of those documents had the element of electrification of rural villages in it, but only 10% of it was ever implemented. So it's a question of municipalities lacking capacity to implement certain things, which when I contracted ESCOM, it says this is the competence of municipalities, and if they are unable to implement this project, to me, it is simply a case of incapacity from their side. So that's why I said it needs a party that will take care of the needs of these people, so that each and every little thing that matters most to the rural people must be implemented. It's not a question of not having resources. It's a question of lacking people who can be able to implement all these programs.
We spoke of the issue of access to taps. A colleague mentioned that water in rural areas is also a problem. If you do not have a borehole, you have a JoJo tank, or you have nothing at all. What is your understanding of the issue of access to water?
Yeah, let me give you one example of Sekhukhune region, which has 5 most biggest dams in Limpopo. But all the villages around those dams do not have running water in their homes. You will ask yourself one question: with this abundance of water sources, what will be the problem of these people not being given water as it is supposed to be? And then one comes to one conclusion that there is another area of incapacity in terms of municipality personnel. I can give you an example, because in this current financial year, Sekhukhune District Municipality returned 170 million rand, which was earmarked for water reticulation. Then it tells you that someone in that office doesn't have the capacity to implement and doesn't have the capacity to plan properly on how to roll out this program of water provision. The same situation boils down to corruption, because all the projects that were supposed to have been implemented, all of them have big projects that are incomplete. Another example is the Nandoni Dam project in Guyane, which was given 90 million for completion and ballooned to 4.1 billion, but without a drop of water from the taps. So it tells you that it's a combination of incapacity from the municipality level as well as corruption by those who are connected to the political party that is in government right now.
How closely will you need to work with municipalities, sir?
Municipalities are one sphere of government that we can't ignore. We have to work with them, but the only thing is that they are not monitored. No one is checking whether programs that they plan to roll out are in fact implemented. It's just a free for all, and no one is accountable. So if we come to power, we will ensure that we decentralize this water authority services so that they could be controlled from one central point, which is closely monitored to ensure that all the targeted and budgeted projects are implemented according to the plans that they submitted.
Another colleague mentioned the issue of health, that there's no medicines in some hospitals or clinics. There are long queues, and if you need to get to a hospital, for instance, and you're in a rural area, when you get to the clinic, finally, they're going to be wanting a referral letter from your local clinic. What is your understanding of the health system in the province, and how do you plan to at least alleviate some of the pressure from the municipalities that you have quoted a number of times, because you're saying competency of municipalities is a problem, whether it's in capacity or personnel?
The clinics around the whole of Limpopo are a nightmare. You will struggle to even find a painkiller in those clinics, and you will wonder when you hear the MECs tabling budgets and indicating a whole lot of things, but when you go to the ground, you happen to see nothing of that happening. And the clinics are not working 24 hours as if people should plan on how and when to get sick. And it's a nightmare in the clinics. And the only thing that needs to happen is that this issue of tendering system for the supply of these medicines is also a gigantic problem in far as we are concerned, because it's also not closely monitored, and the needs for the specific clinics are not catered for in terms of the way they budgeted to receive certain things based on the population that they are servicing. So we will come in as ActionSA, ensure that we go straight to the manufacturers or suppliers instead of going through the tender route to supply all these clinics with medication. That is the only way that we see improving the situation at the clinics in terms of supplying of medication.
Kgoshi Letsiri Phaahla, ActionSA Limpopo Premier Candidate. Thank you very much, sir, for your time this afternoon.